Community Advocates works with individuals and families in Milwaukee to make sure that they have access to their basic needs. We've always been involved in looking at how the policies that exist in our community are affecting the people that walk through the doors. Our leadership team created the Public Policy Institute in 2008. David Reamer was tapped as its first director because of his long history in policy work as a researcher and member of local and state governments.
Our primary goals are analyzing and advocating for policy change, coordinating coalitions and convening citizens, and helping community-based agencies impact poverty through prevention work. These include a focus on positive youth development, reduced tobacco use, substance abuse prevention, anti-violence efforts, smart reentry after incarceration, minority male achievement, and transitional jobs.
The Parenting Network has been a longtime friend and partner of the Public Policy Institute. We have worked on child abuse and neglect prevention, we've worked on AODA prevention, teen pregnancy prevention, and the work in their Public Policy Committee has been something that our agency has been engaged in for a number of years.
Ppi Convened Coalitions today include the Milwaukee County Substance Abuse Prevention Coalition, the City of Milwaukee Tobacco Free Alliance, the 53206 Drug Free Communities Project, the Milwaukee Reentry Council, the Alliance for Wisconsin Youth Southeast Region, the Teen Pregnancy Prevention Network, and the Milwaukee Transitional Jobs Collaborative, including Healthy Workers, Healthy Wisconsin, and the Transitional Jobs Project.
The Milwaukee County Substance Abuse Prevention Coalition and the Public Policy Institute allow me to do a better job with working across sectors and use what's called a strategic prevention framework to identify problems and work together collectively to come to solutions.
Ppi is not a direct service provider, which is an asset to the community because it places us in a role of supporting other community-based programs and never competing with them for market share of direct service funding. Ppi directs grants to community partners engaged in positive youth development through our Milwaukee Brighter Futures Initiative, Stay Strong Milwaukee, the Alliance for Wisconsin Youth Southeast Region, the Bureau of Milwaukee Child Welfare, Partnerships for Success, and the Opioid State Targeted Response Project. The Public Policy Institute, or PPI, officially launched with funding from the Milwaukee Addiction Treatment Initiative. Addiction can cause or be a symptom of poverty, so it made perfect sense to create a partnership to expand affordable and accessible addiction treatment.
In addition to our work that we do with substance abuse, we also can come to the Public Policy Institute to request trainings for mental health wellness activities as well. Suicide prevention is huge, and that is a key tool in our toolkit that we can have as clinicians and professionals in working with people to identify some of those problems and help direct them to resources.
No one agency can single-handedly impact large-scale community change. And so we need that system, we need the structure so that all of us come together and we're working towards a common goal so that there's purpose, intention, and direction behind our work. Only then will we be able to, as a community, really impact the large-scale change that we're looking for.
With some of our bigger policy work, we've partnered with U.S. Senators Tammy Baldwin and Cory Booker on the reintroduction of the Stronger Way Act, which was based in part on our Working Our Way Out of Poverty project that we did. That, combined with some of the more traditional prevention work that we do, we're making truly big impact in our community.
The Stronger Way Act. This wouldn't have been possible without the partnership of community advocates and their strong record over many decades. This legislation recognizes that we can do more to strengthen the economic security of working families with targeted tax reform, like expanding the earned income tax credit for working Wisconsinites.
After my divorce, I worked for Lake County Press as an accounting assistant. Due to corporate downsizing, I was laid off. As a full-time student, even working multiple jobs, I incurred significant debt. If it were not for this credit, I truly believe I would have lost my house throughout those recent years of struggle.
2009, the year transitional jobs became a reality, was pivotal for us. The Wisconsin budget included an amendment creating a transitional jobs demonstration project authorizing 2,500 subsidized jobs. The subsequent Wisconsin Families Job Act allowed for the inception of the Milwaukee Transitional Jobs Collaborative, which is still in existence today.
This is anti-poverty policy that works. It respects work, it offers work, It encourages and rewards work.
It put my foot in the door to where I was working for the company, but being paid by the transitional job program. And it gave me a chance to prove myself. And at the end of the program, the company that I was working for and still working for today said we're going to hire him.
What I particularly am excited about in 2018 is that we have the opportunity to get back to our roots in really sort of exploring housing policy. We have clients coming through our doors on a daily basis dealing with a number of housing challenges, and this work will allow us to both research good policy, both locally and across the country, and really take that and try and advocate for change.
I feel very fortunate to be the Chief Executive Officer of Community Advocates because I truly believe in the work that we do, and it's part of a passion that I have for making sure that people are able to meet their basic needs for themselves and their families, and happy to be able to support the vision that was created 40 years ago and expand on that vision and celebrate the 10 years of the Public Policy Institute.
Without my staff, without our funders, and without these partners, this work simply couldn't be done.